This video is intended to aid your clinical reasoning by developing a diagnostic framework for a child with a fever. This should hopefully make it easier for you to consider differential diagnoses in a more structured way. We'll also discuss some important facets of clinical reasoning. Let's start off with a case scenario. Imagine you're a fourth-year medical student at home in 2021 in Sydney. The peak of the COVID-19 pandemic has pushed all your exams, including your impending paediatric OSCEs, to Zoom. You sit looking blankly at the other terrified students in the online waiting room, and they also seem to be on the verge of a panic attack. This makes you feel better. Knowing you might finally be able to see people you know at the local psychiatric hospital fills you with a morbid sense of relief. After waiting for a couple of hours, you finally get moved into your first ever PEDS OSCE. A 3-year-old male is brought in by mum with fever and lethargy. He has a temperature of 38.7 and is looking mottled with a thready pulse. Other than being slightly tachycardic, he has no other abnormal physical exam findings. The examiner asks you to give a set of structured differentials based on this case. You see your face in the small video box in the corner of the Zoom. You don't know what the diagnosis is. You look visibly panicked, and you really don't want to repeat the year. Again. Given the very non-specific scenario, let's start our diagnostic framework with a really broad approach. Vitamin is a very common mnemonic to remember key differential areas for most presentations. It stands for vascular, infections, traumatic, autoimmune, medications, idiopathic, and neoplastic causes. Although you have no clue what this 3-year-old actually has, you describe the structure and provide an example of each. It's revealed that our young boy has a non-blanching petechial rash on his legs, which are cold to palpation. He's recently been sick with an urti and still has a bit of a runny nose, which has been going on for a while. You're then asked what you want to do for the patient with all your many years of pediatric experience. Before you answer, you have to reassess what the new set of differentials are and what the most likely one is. Remember that clinical reasoning is an iterative process and it's often probabilistic and can be imprecise. Now we know our patient has a rash, let's think about more specific differentials in this age group. I like to remember there are a couple of really important conditions in PEDS that are often associated with a petechial or purpuric rash. I remember that I hate milk. It stands for henoch-schönlein purpura, meningococcal disease, immune thrombocytopenic purpura, leukemia, and Kawasaki's, although this usually presents with a maculopapular rash. Given this, let's once again revisit our case and go through an iterative process to reconsider the differentials based on their likelihood. In my view, the most likely differential is probably infectious, specifically from acute meningococcal disease. Autoimmune diseases like HSP and Kawasaki's are possible, but less likely given A, the acuity of the presentation, and B, the characteristic rash. For similar reasons, leukemia and ITP are low on my list. To review, structure is the key to differentials, especially when you're stressed. The more non-specific the presentation, the broader your diagnostic framework should be. The vitamin mnemonic can help you with almost any presentation. Diagnostic reasoning is an iterative process, and it can often be imprecise and probabilistic. Finally, I hate milk is a great way to remember important causes of rash that shouldn't be missed in kids. Thank you for watching Townsend Teachings. Don't forget to hit the notification bell, like, comment, and subscribe.